Good morning, everyone. It's good to see you. My name is Guy Lamb. I'm Director of the Safety and Violence Initiative, so welcome to this International Conference on Violence Prevention. Really glad to have you here. I know it's an early start, and for some of you who traveled here by car, who live in Cape Town, it is a bit of a trek to get here in the morning with all the traffic, so thank you for being here. This morning we've got a kind of a much shorter opening session than anticipated, because we had thought that maybe we'll get a high-profile government speaker to speak, but many were busy and their schedules are hectic this time of year, so it's really just going to be sort of some brief introductory remarks from Professor Anwar from the University of Cape Town and Dr. Alex Butchart from the WHO. But before I get to introducing them, just a few logistics around this particular conference and how things are going to work today. So as you've seen from the program, it's really, really busy. Time is incredibly tight. So we're going to having pretty much all the time 3 sessions running in parallel. And they're all around here. You just need to look at the signs on the doors because they will announce or indicate where the panels are happening. So we're currently in the main venue at the moment, and then there are 2 breakaway rooms which are right next to us. Also in terms of there's tea breaks and lunch breaks, and I understand that it should be served outside, but just kind of keep an eye. They may move it, but I understand that they will be serving teas and coffees and snacks and refreshments and lunch outside. Also, for those of you looking for the toilets, you'll need to head out of the conference center and sort of walk to the area where the lifts and the staircases are, and you'll see the signs to the bathrooms, toilets over there. And I think just, we're going to try and keep to time. And I think it's, through each session, it's tight. So I know people don't have a lot of time to speak. So it's just a request to all those who are chairing the sessions to be, if you can be quite rigorous and disciplined when it comes to timing, because we also would like to have some space for people to discuss. We don't just want people presenting and then there's nothing, no one can ask any questions or make any comments, because that's the reason why we're here. So without any further ado, let me kind of introduce the 2 speakers. Both have indicated that they really want to only speak for a few minutes and just make some introductory comments. So speaking first is Professor Anwar. He is the Deputy Vice Chancellor at the University of Cape Town. He is responsible for a very large portfolio that deals with transformation, social responsiveness. So he is responsible for the Safety and Violence Initiative, making sure it's getting its job done within the university. But he's responsible for a range of other things, from student issues to transformation of the university, to HIV/AIDS, to institutional planning. So he has a very full plate. So we're very grateful that he could be here. He's going to speak first. Then after him, Dr. Alex Butchart, who is a South African, so we're very fortunate to have him here. He's based in Geneva for the WHO. He is responsible, sort of the point person for most violence prevention work, particularly the Violence Prevention Alliance. And we've just 2 days before this conference had a Violence Prevention Alliance sort of strategic meeting, plotting the way forward for the alliance, which is made up of a number of institutions, universities across the globe that try and look at coordinating work on Violence Prevention Alliance. Dr. Butchart is a clinical psychologist by training, but has been working in the injury prevention, violence prevention field for many, many years. And he's sort of the point person also on the implementation of the WHO's kind of commitments to violence prevention. So without any further ado, let me hand over to Professor Mol. And then when he's done, I'll ask Dr. Butchart to come and speak. Thank you.
Thank you, Guy. Good morning to you all. It's really nice to be here. I wish I could stay for the day, but unfortunately, my job wouldn't allow that. But I must tell you, I'm very proud of myself that I came in this morning, and when I parked my car, I wrote on this piece of paper, P2D5, because I remember recently flying back to Cape Town from Durban with my wife and having to walk through 2 huge parking lots looking for my car and pressing my remote. So I think that has been a successful start to the day. So I've been working with Guy and Julie and others for a little while. I'm an acting Deputy Vice Chancellor talking about crime on campus, and I've been amazed at their dedication to this. And I've been so grateful for them because they've brought in so many different and new ideas and a new angle to looking at crime on campus. I've been an academic at UCT for many, many years in the health sciences faculty, in the Department of Surgery, but I've also been involved a lot in student affairs. I've been a warden for 27 years, so you can understand why there's no hair on my head. And one of the things we did find is one of the greatest problem. I shouldn't call it a problem, but it is a problem. Greatest problem about crime in a student community is the lack of vigilance among students themselves. Young people just don't really care about their own safety because they're young, they're brave, and have to be reminded all the time. Please lock your room. Please do this. Please don't walk alone at nights, speaking on your cell phone in the street. And I've been actually leaving my house, because I live in a student area, at night and taking a walk down the street and talking to young people and say, look what you're doing. You're exposing yourself. And they just shake their heads and say, Professor Mal, don't you ever sleep? You know, totally indifferent. Now, as acting Deputy Vice Chancellor, one of my portfolios is to be overseeing the Transformation Office, and that deals, one component of that deals with crimes of a sexual nature. And during the protests, these crimes of a sexual nature were brought to the fore. And I was amazed that in all my years at UCT, when I thought that I had a fair knowledge of what was going on this campus, it wasn't so. And I've had both protesting students and other students come to my office every day and tell me how they've been made vulnerable in our environment. Okay? This morning while I was driving down here, I heard a statistic on the radio that there are approximately 50,000 rapes in this country every year. And then they had Lisa Vetten, whom I've admired so much over the years, commenting about it. And then the Deputy Minister of Education, who spoke about what they're doing in schools. And it struck me then that we're dealing with this at a tertiary level, but the actual work should start in the schools. So on a trip to London recently, I think it was about 2 years ago, there was a huge outcry when a woman driving in Chelsea in broad daylight at about 11 a.m. in her 4x4 was hijacked. And the newspapers were full of it. The news was full of it. And I thought to myself, my God, this happens in my country on a daily basis. Have we become so inured to crime? Have we become so immune to it? In fact, we don't only have hijackings, we have crimes of a far worse nature. And then there was this outcry from people living in London saying, it's all these Eastern Europeans, we shouldn't have them here, they come here jobless and they rob us. So that is a question that I think we need to consider. Have we become immune to it, and do we live from one criminal statistic to the other? I always told my students, both in class and when I spoke to them in other fora, that it's amazing that the 20th century gave us the biggest advances in science. I mean, we've come to a point where we can send out a probe to a moving comet, right, which then sends back information to the Earth about the nature of that comet. I mean, this is happening in our lifetimes. It is absolutely unbelievable. And yet, if you look at that very same century, which gave us the structure of DNA, which gave us the mapping of the human genome, which gave us so much, starting from the beginning with Einstein's theories, we've had the most deaths in history. We've had leaders, criminals posing as leaders in the names of Adolf Hitler, Pol Pot, Joseph Stalin, the leaders in Bosnia-Herzegovina. What is it about us that we, in our evolution, could come to a point where we are so advanced scientifically, and yet we cannot get it right in our human relationships. It's a question that bugs me very much. But I am not going to stand here talking about these issues. These are issues of personal interest, but I just wanted to share some of them with you. But I want to wish Guy and the organizers of this conference well. I want to congratulate them on the work they do. I've been an admirer of theirs, and I want to thank them for the contributions they're making to UCT in terms of how to deal with these issues. Thank you very much.
Thanks so much, Professor Moll. I'd like to invite Dr. Butchart to come up and say a few words. Thank you.
Thanks, Guy, and thanks, Professor Moll. It's a great pleasure and an honor to be here because not only am I a South African working for the World Health Organization in Geneva, but I also did my undergraduate studies at UCT. I was also at the inaugural event of SaVI in 2011, and it's fantastic to see how SaVI has grown and evolved into a really strong organization which is it has a local focus, but it's of global relevance. So well done to SaVI and UCT for supporting it. WHO is really delighted to co-sponsor this conference because it obviously provides a great forum to share and consolidate violence prevention learning, experience, and most importantly, evidence, not only from Africa, but internationally. And WHO is delighted to sponsor it because we have a really strong mandate from member states, including South Africa, Malawi, Zambia, and the rest of the world, to address violence. And this mandate is based on 3 core reasons which make it a very clear public health priority. First of all, and the most obvious reason, violence itself is a leading cause of death and leads to millions of serious injuries each year. Anybody working in an emergency medical department can testify to that, and you just have to look at the burden of disease statistics to realize how high up the cause of death ladder violence, in particular among young males, falls. In addition to that, and maybe even overshadowing the large number of deaths, violence is a major risk factor for high-risk behaviors such as smoking, alcohol use, illicit drug abuse, unsafe sexual behaviors, including multiple sexual partners, failure to use condoms, etc., sedentary behaviors, obesity, and so forth. And via these, it's a risk factor for some of the major killers, non-communicable diseases such as cardiovascular diseases, diabetes, and so forth, and HIV/AIDS. So the third reason that WHO sees violence as a key public health challenge is that it is a winnable public health battle. Because at the population level, and I'm sure we're going to hear some fine studies which demonstrate this, interpersonal violence is highly predictable. It's really, really very, very predictable in terms of the who, what, when, where, and how. And because of this, it's utterly preventable through evidence-based strategies that address the underlying causes and the risk factors. But moving local and national authorities to a position where they are brave enough and courageous enough to work on these underlying causes is the big challenge. The science is there. We know how to do it. We know what to do. But to shift government and local government attention to these without necessarily taking the foot off the gas in terms of deterrence through policing and so forth is the big challenge. WHO, like many other partners within the global violence prevention community, is no exception in depending upon the work of its partners to get things done. And we count UCT and SaVI as 2 of our really strong, long-standing partners in this work. And I'm sure that with this conference, our networks of collaboration will extend to include most of you in this room. And I therefore really look forward to it and thank Guy once again for the nice intro and for organizing this. Thanks, Guy.
Thanks so much, Alex. Thanks, Anwar. We've gained a bit of time, but but it's also we are quite short on time. So I would like to suggest now that we move into the parallel sessions that are happening at the moment. And they're happening in 3 venues, as I said before. What's happening in the main venue at the moment, what's going to happen in this venue at the moment is addressing and preventing gender-based violence in South Africa. Then in Breakaway 1 is going to be exploring violence in its variety, and that's going to be chaired by Llewellyn McMaster from the University of Stellenbosch. And then Breakaway 2 is children's experiences of violence in South Africa, and that's going to be chaired by Shanaz Matthews. So I know choices are a bit difficult, because there's some really interesting papers in all of them. But yeah, so if you don't mind kind of moving in the next few minutes to these particular venues, and hopefully we can get started in the next 5 to 10 minutes. Okay, thank you so much.